Hi guys, Dr. Sheehan here, and I'm a diplomat in the International Congress of Oral Implantologists right here in beautiful Waterford. And in this video, I'm here to share with you some of the deepest insights that we can share with you as a dental professional. I'll be sharing with you the top 5 questions that you should be asking a dental provider prior to committing to dental implants. And in these very quick, easy questions, you'll be able to determine their credibility and whether you should be having them do your dental implants. Question number 1, what is the provider's formal education in dental implantology? So who were they trained by? What form of education did they get? And how long did it take them to get their training? These questions are all related to the dentist's formal training on dental implants, and they're really important. So for example, I've gone to multiple CEs on dental implants, and I have my diplomat in the International Congress of Oral Implantology. You'll ask, what does that mean? So that's one of the only board certification programs in the United States that distinguishes the highest level of education in dental implants. I travel nationwide to help coach and train other dentists in dental implants and in dental implant prosthetics. I have over 2,000 hours of dental CE and a majority of them related to dental implants. So if you feel like they don't have a lot of formal education, go ahead and don't be shy. Ask them, what kind of guarantee do they offer? How many of these implants have they done before? What's their success rate? You need to make sure that you have confidence in your provider. Question number 2. Does your dentist have a CBCT scan in their office? Easy words. Do they have a 3-dimensional imaging machine in their office? Okay, so this is something that's a little bit more complicated, and sometimes patients don't understand the difference or why it's important. Let's take a look over here so you can see what I'm talking about. Let's make this very easy. So if you see right here, this is what's called a Panorex X-ray. This is going to give you a 2-dimensional evaluation of somebody's mouth. Right here's my mouth, okay? So you can see right here, here's all my teeth, and you can see where the teeth and where they are next to each other. But what you can't see is where's the nerve? Where's the artery? How much bone do I really have? How thick is the bone? That's where this comes in handy. You want to look at the 3-dimensional. You can see where the nerve is. You can see how much space you have between teeth. You can see how wide the bone is. So, of course, all of these things are going to dramatically decrease the risks involved with implant surgery. We pre-plan everything on the computer so that way it's fast and easy and it's very predictable. So we have a CBCT right here in the office, and I use it every day to make sure that my patients are safe. And I would never place an implant on somebody without one. I would never let somebody in my family have one without one. It's just too risky. The technology is here to help us make this very easy for you. Question number 3, will the dental implant and the crown be placed in the same office? So often in a general office, there's going to be 2 doctors involved. There's going to be the surgeon who actually places the implant, and then there's going to be the dentist who puts the crown on the implant. And there's nothing wrong with that as long as those 2 doctors work very closely together to make sure you have a great result. Now, that can add a little bit of time and a little bit of cost because now there's 2 people involved. I have to tell you, I've seen before where an implant has been placed and a different doctor puts the crown on, and if those 2 doctors didn't work well together, you end up with a weird result. So the best thing for you to do is to look for an office where either you have a surgeon and a doctor who work very well together and they do a lot of cases together, or find somebody who does everything from start to finish. So question number 4. How is your dentist going to take into account your specific medical conditions? So the success of your dental implant is going to be largely dependent on your medical condition and how your surgeon customizes the treatment to you. For example, if you have diabetes, we take different steps to make sure that you heal properly. We may do things in different steps. We may add more time for healing. Somebody might have a vitamin D deficiency, and we work with the primary doctor to make sure that patient's vitamin D levels are brought up to where they need to be so they're a good candidate for implant surgery. If you're a smoker, there's a lot of different things that we need to make sure we're taking account of. So you want to make sure that your dentist is very much aware of all the medications that you take, all of your past medical history, so you can have a successful outcome. Question number 5, how accessible is your surgeon after surgery? This is a must. After you have your surgery, what if you have a question? What if something happens where your suture comes loose, or you have a question, can you eat something? You know, you're having some discomfort, or you have something that you need to talk about. Okay, I'm just gonna put this in as a side. This is why it concerns me when I hear about patients traveling for implant surgery, like out of the country. You need to make sure that you can get a hold of your provider in case you have any problems. If you fly somewhere and you have a problem, you're gonna have to turn around and fly right back. That's a big problem. So you want to make sure that you have good access to your surgeon, that they're going to communicate with you, that you feel comfortable reaching out. That way you can have a great experience. So those are the top 5 questions that I have, fast and easy, for you to evaluate whether you should be getting a dental implant with that provider. I hope you found this video useful. If you did like it, go ahead and give it a thumbs up and share it with your friends. Until next time, this is Dr. Amanda Sheehan at Oakland Family Dental in Waterford, Michigan.